Hi, I'm Jesus Bustillos with Plans for Life, and thank you for watching this video where we aim to help you become a more informed consumer. We're going to be defining important terms that you may experience using your healthcare plans. And today we're going to be breaking down the special enrollment period you might have heard about there, and how you can enroll in marketplace coverage when it's not open enrollment. Secret stuff. You can enroll in a private health plan through the marketplace outside of open enrollment only if you qualify for a special enrollment period. And you may qualify for a special enrollment period if you have a qualifying life event, like you have a child, you got married, you're moving outside your county, losing minimum health insurance coverage like through your job, Medicaid or children's health insurance program for kids. Your estimated household income is under a certain range. You absolutely have to have one of these situations in order to be able to get coverage. And one of these is very, very simple to take care of. So if you have an unexpected situation, you face a serious medical condition, a natural disaster, or some other national or state level emergency that keeps you from enrolling on time, for example, will allow you to also enroll later. So an unexpected hospitalization or temporary cognitive disability or otherwise being incapacitated. Okay. Also, a natural disaster, like I said, is a natural earthquake, massive flooding, hurricanes, anything that would be qualified as a natural disaster. Most of this would already have gone through FEMA or some kind of a public assistance program, maybe something authorized by the state. So those are all also situations which allow for people to get a special enrollment period. If you face a serious medical condition, natural disasters, or other national or state issues like that, emergencies, you have 60 days from the end of those FEMA type designated incidents in those situations to complete your enrollment with marketplace coverage. So you can also ask to have that plan start date be when you would have picked the plan, if not for the disaster. So for help enrolling through these special enrollment periods, please call us, schedule an appointment, and get you covered. There's quite a few different things to understand about some of these special enrollment periods, which ones might apply. So it's important to have a good open conversation to help you understand. Enrollment and plan information display errors are also another reason why you may qualify for a special enrollment period. Let's say you're looking at the information for a plan online, you're making a decision, but the information is not exactly what was promised. There's misinformation, misrepresentation, misconduct, some inaction of someone working in an official capacity to help you with the enrollment, like an insurance company person, a navigator, a certified application counselor, an agent or broker. Maybe they kept you from enrolling in the plan that you wanted to, the right plan for you. Maybe getting the premium tax credit that you were supposed to, or the cost sharing reduction you actually qualified for. Maybe there was a technical error that happened when you were applying for coverage on healthcare.gov. And you probably saw an error when completing the application that prevented you from finishing the enrollment in the plan. You may have had a health insurance company keep you from getting the enrollment done because they had your information or some other weird thing like that. Any kind of wrong plan information that's displayed on healthcare.gov at the time that you selected the health plan will also qualify, such as benefit or cost sharing information. So becoming newly eligible for savings on a marketplace plan because you lived in a state previously that hadn't expanded Medicaid is also an option, right? So if you were in a state where they didn't have the premium tax credits available through the state, and or because your income shifted and now there's a shift there, sometime in the last 60 days, if you had an increase in household income removed, again, all of these may create different options that we should discuss. If you've been found not eligible for Medicaid or CHIP coverage, or your children also qualifies you for a special enrollment period where you can enroll for coverage within a 60-day enrollment window. Gaining or becoming a dependent due to a court order. If you've gained a new dependent or become a dependent of someone else due to a child support or other court enforcement situation, then you have coverage that starts the same day as the effective date of the court order, even if you enroll in the plan up to 60 days afterwards. Domestic abuse or violence or spousal abandonment is another special enrollment period. If you're a survivor of domestic abuse, our heart goes out to you. Please reach out to us. We'll help you get to the resources and to the help that you may need. If there's spousal abandonment, or if you just simply want to enroll in health insurance, again, these provide special enrollment periods that you would have otherwise not necessarily qualified for. And they're separate from the person that might have been your abuser or your abandoner. Your dependents are eligible to be enrolled under you as well. So if you're married to your abuser or abandoner, you can answer on your marketplace application that you're unmarried. You may be eligible for premium tax credits and other savings that are on marketplace plans if you qualify based on income. Or a successful appeal decision. If you filed an appeal with the marketplace and the decision was in your favor, you'll have the option to enroll in coverage or change plans. You'll get a letter from the Marketplace Appeals Center finalizing the decision that will explain the changes and how they've made the decision and your next steps. If you think you qualify for a special enrollment period, by the way, you do, give us a call. We'll help you get taken care of. Don't hesitate to set up an appointment. Our phone number is below, 915-591-1957. Don't delay. You got to get covered. It's the smart thing to do. We'll get you taken care of. We'll ask for the information about your situation to check if you qualify for this or the other special enrollment period. Assuming you qualify, we'll help you get taken care of, take care of the application for the subsidy as well as the application for coverage. If you're already enrolled in a plan and you feel you may be eligible for a special enrollment period again, you might be able to stay in the same plan, make some other changes, or switch plans. In limited cases, you may qualify for an earlier start date of coverage. Remember, you must make the first premium payment for your coverage to start. If you have an appeal that needs to be filed because maybe benefits or the enrollment were denied, if the marketplace denies such benefits, again, we can help you with that process. If your appeal is successful, you can get coverage back due to your date of the special enrollment period being denied. If you care to learn more or simply want to stay informed, subscribe to our channels. Please give us a thumbs up and watch our other videos on this topic. You can scan the QR code below so that you can see all of our other social media profiles. You can also call us at 915-591-1957. I'm Jesus Bustillos with Plans for Life, where we help you plan so you can live fearlessly. Have a blessed day.